One of the most problematic complications, or the most problematic complication with breast augmentation is something known as capsular contracture or hardening. This is the development of scar around the implant internally. And even though it's called hardening, what I find the actual problem is that it'll make your breast look weird. It can make the breast too round, or it's sort of pushed up and the other one's sitting normally over here. Now, there are things that you can do during the surgery that lowers the risk, and I do all those things. Included in that is, it's known that if you put the implant under the muscle, and perhaps if you use a textured implant, it can also lower the risk of capsular contracture. My main concern is that bleeding is a trigger for capsular contracture. So when I do the surgery, I use a couple instruments that help me tremendously. One is what's called a Fiberoptic breast retractor. Essentially, a light source is attached here, and the light travels through the instrument with fibers, and it comes out the bottom here, shines a light this way. This is the retractor part of the instrument. What this allows me to do is it allows me to insert this into a very small incision, lift up, and look inside the breast and see exactly what I'm doing. The other instrument that I use is known as a unipolar electrocautery forceps. This is actually a foot-activated device, so I actually turn it on and off during the surgery with my foot. It sends electricity down to the tips, okay? Nothing happens over here because it's insulated. And using this, I can actually do the whole pocket dissection. I can open everything up. It's bloodless and it's relatively atraumatic. And if I see a little blood vessel along the way, I can grab it and cauterize it to minimize bleeding. I don't subscribe to the method where you make an incision, you find the muscle, you get your finger under there, or you put in some big honking instrument and you go, okay? That's very traumatic, causes a lot of bleeding. A couple other things that I would recommend is after the surgery to restrict your activity levels, because I don't want you doing anything that could cause bleeding, which may trigger off the hardening. So I don't want you to be at the gym for 3 weeks, and I don't want you to do anything heavy with your chest muscles for 6 weeks. I do not get my patients to do massage. In my mind, to start massaging the breasts 7 to 10 days after the surgery, I'm thinking everything's raw inside. You start massaging, it might trigger off bleeding, which could cause the hardening. Not only that, it's sore. So I like, everything to cool off, everything to settle and soften on its own. Under my supervision, I'm watching to make sure that everything is happening properly. And 99% of the time, you are not going to need to massage. In my practice, putting all of this together, I've been able to keep the capsular contracture rate very low. It's 1%. In traditional techniques, and there's certainly nothing necessarily wrong about it. A lot of my colleagues do this, but they'll make the incision, they'll say find the muscle, they get underneath that muscle, they get their finger in there, or they put a big instrument in there, and they open up the pocket. There's a lot of bleeding, there's a lot of trauma, and it's just my feeling that those factors could lead to capsular contracture or hardening of the breast. So I subscribe to this bloodless breast augmentation specifically to try to avoid this problem, which is the biggest complication with breast augmentation.